I'm Rusi Jaspal and I'm Professor of Psychology and Sexual Health here at Montfort University. I conduct research into HIV, specifically among men who have sex with men. That's also referred to as MSM. There are two main strands to the research that I do. The first one examines the social and psychological factors that can lead some people to engage in behaviours that put them at risk of HIV. The second strand of my research focuses on how we can improve health outcomes among people living with HIV.
Rusi has an interest in a number of things that kind of blur with my interests. For example, populations that are BME, gay and bisexual men, and PrEP. So once we've got a basis of a relationship, a research relationship about my questions on the ground, what can I do for patients, and Rusi's academic knowledge, the two together are very powerful because you've got this constant backwards and forwards of ideas about how to improve the research and how to improve clinical practice.
So our research taps into some of these issues and enables us to improve care for those living with the condition.
By bringing together partners, we can try and solve common problems, and by having both the clinical support and the academic support, it enables me to do a better job.
Montfort University is committed to interdisciplinary research. We have 4 faculties and researchers across these faculties collaborate very closely around issues such as HIV.
There are many challenges still left at preventing HIV. It's still not gone away. And it depends on kind of what population you're looking at. So discussion of HIV is still very taboo in certain communities, therefore getting them into clinic and getting them tested, understanding why they need testing is very important.
I think this research is a great guidance for us to sort of understand how people living with HIV from a different cultural context sort of behave and so on. So it gives us the tools really to support people in a better way.
Working with Rusi at the Montfort has really helped us interact and engage on that local side, and actually by working with those local communities that we work with, engaging in the research, we know that it's going to be having a wider impact, not just locally but also nationally.
The work has massive social impacts. I mean, if we get even 3 or 4 HIV diagnoses from this population that we didn't have before, that's a massive public health outcome.
We've got enough battles to fight. So what I do hope is with the research we look more about stigmatism and how stigmatism is linked to not just the physical issue of having a blood-borne chronic condition, it's more around the sociology around that.
Sitting in a clinic room, talking to patients that come and see us, that's the easy part because we know what we're doing, we've been trained for years. The difficult part is getting people that don't come to our clinic, and that's where the academics come in and the research is about trying to engage with populations to help us understand why they don't come and see us, what we can do to help them, facilitate them into the clinic and get them tested as much as possible.
Socially, there is still a lot of stigma around HIV, specifically within the gay community. There's a lot of stigma around the transmission of it and also new terminology which is coming out, and with Rusi's help it's really managed to help us solidify the research and the evidence that we need.
If we intervene early enough, I believe we can defeat HIV and we can stop the spread of this incurable condition.